Hi, everyone. I'm Nick Bailey. I'm one of the co-founders of From Day One, which is a forum on corporate values. I'm really looking forward to hosting today's webinar, so thank you so much for joining us today. Before I do, though, I wanted to share something special that we have for attendees of today's webinar. That's you. Our next monthly virtual conference is coming up on May 19th. This one's entitled Diversity, How Employers Can Match Words with Deeds. Our diversity content is some of our most popular content, and our virtual conferences are all day or 3/4 of the day events that have workshops, panel discussions, abilities to network and communicate with your fellow attendees, chat, and lots of interesting things that go just beyond this Zoom webinar experience. They're really neat. We host them on the Hopin platform, and we do them once a month. So thanks to our partners, and especially thanks to today's sponsor, we have complimentary VIP tickets that are available to those who join the webinar today for this event that we're doing on May 19th. So that's you. I'm putting that link in the chat right now. So if you look at the event chat, it's at the bottom of your screen in Zoom. It says chat. If you click on that, you'll see a note from us and a link. You want to take advantage of this one if you can. The regular price for conference tickets that we do every month is $149. This is a link that gives you a free VIP ticket that gets you into the entire day's activities. And again, that's thanks to today's sponsor and our partners. So with that out of the way, please do click and join. And on to today's webinar. Today, we're going to be exploring a topic that focuses on the ways in which companies can support employees through the fertility and family planning process. Our title for today's session is Helping Your Employees Navigate the Fertility Journey. For corporate employers, fertility benefits have become a very high-profile part of the employee value proposition. But there's a challenge involved. You have to guide prospective parents through an intricate and emotional process, and that calls for an approach that's both sophisticated, planned, and empathetic. So what are the best ways for HR professionals to inform, to support those prospective parents as they start to make one of the most important journeys of their lives? The sponsor for today's panel is Maven, and I'm going to tell you a little bit about Maven. Maven is the world's largest virtual clinic for women's and family health. They have a unique care model that enables employers and health plans to improve clinical outcomes and to lower maternity-related costs while empowering parents to grow their families while growing their careers. They were founded in 2014 by CEO Catherine Ryder, and since then, Maven has been recognized as Fast Company's #1 most innovative health company, and they've supported over 5 million women and families. Thanks again to them for sponsoring today, and on to a few quick logistical items before we get started. This webinar is being recorded. It will be available on demand soon after the event. You can look out for an email from us. That'll come in about 24 hours, and that email will have a link to today's panel if you want to share it with somebody else or watch it again. That email will also have info on how you can get professional development credit. It's a very common question. So the answer is tomorrow in that email from us, you'll get the details for professional development credit from Society of Human Resource Management, that's SHRM, or HRCI, our two professional development partners. Finally, look out for a written account of this conversation. That'll be on our website as well. That's at fromday1.co, FROMDIYONE.co. About 45 minutes after the hour, that's in about 42 minutes from now, we're going to have a Q&A session. And you can submit your questions for the Q&A then or now or at any time between now and then. And you do that by using the Q&A button. If you're in Zoom, that's on the bottom of your screen. Just hit Q&A, and that will be forwarded to our moderator, Lydia Dishman, who I will now introduce. Lydia is a contributing editor for Fast Company on topics including tech and leadership. She's also written for CBS Money Watch, Fortune, Popular Science, the New York Times, and she's been a frequent partner of ours and one of our favorite hosts for our webinar content. Lydia, thanks again, and over to you.
Thank you so much, Nick, and thank you, everyone, for spending the next hour with us. We are sure that you're going to get some great insight to take to your organizations. I wanted to start by taking a look at the numbers. In 2019, over 3.7 million babies were born, according to data from the CDC. Yet for many, when they hear about the fertility journey, they think the inverse, infertility. And indeed, according to UCLA Health last year, an estimated 15% of couples have trouble conceiving. Globally, 48.5 million couples experience infertility, according to the Reproductive Biological Endocrinology, a mouthful there. And a little more data here. The Practice Committee of the American Society for Reproductive Medicine says that fertility declines with age, in case you didn't know this, in both men and women, but the effects of age are much greater in women. So it's interesting to note that anecdotal data from clinics across the country last year suggests that more women elected to freeze their eggs with some clinics reporting double-digit increases. But that's just one component of the fertility journey. This looks very different for same-sex couples, those who choose to be single parents, and lest we forget, while there are no actual statistics on national adoption, waiting list statistics estimate that there are about 2 million couples waiting to adopt a child. So this is as unique and complex an issue as the individual families who are navigating it. So here to unpack some of these issues and provide insight on the many facets of the journey, we've assembled a diverse group of experts, and I'm going to ask them each to introduce themselves and tell us a little bit about their work. Sonia, why don't we start with you?
Absolutely. Thank you so much. Pleasure to be here with all of you today. My name is Sonia Milsom. I'm the Chief Commercial Officer here at Maven and responsible for all of our revenue and our customer lifecycle. Nick shared a little bit about Maven at the beginning, but also wanted to make sure that people understood our mission, which is really to change the health of the world, one woman, one family at a time. And really our global platform helps support that journey from preconception, fertility, including adoption and surrogacy, all paths to parenthood, through maternity, and then also into parenting and pediatrics. And so again, excited to be here today. Thank you.
All paths to parenthood. That's a very concise way of saying and distilling what the complexities are. Marty, over to you next.
Hi, everyone. I'm Marty Cruz. I'm Senior Director for Warner Music Group for the benefit programs, and my responsibility is offering an inclusive and diverse package of benefits to our employees.
Thank you. Jake?
Yeah, I'm Jake Anderson, and I, with my wife, run Fertility IQ. We're an educational platform to help adoption, foster, surrogacy, quote unquote, natural conception. We do it globally, localized offerings, Brazil, Russia, India, China, and a real focus on DE&I. So we strongly believe education is really important here.
Thank you. Deshawn?
Hello, everyone. A pleasure to be here. Deshawn Wise Porter, Vice President of Diversity, Inclusion, and Recognition at Hilton. Of course, leading essentially the strategy for both of those particular areas. And hopefully everyone's had an opportunity to stay at a Hilton where we really believe in the ability in which to bring people together through travel.
The industry that's taken quite a hit this year, but hopefully things are starting to bounce back. Yes?
Oh, recovery is on its way, no doubt. And I think we have pent-up demand in the system. I'm sure all of us have a place in our mind where we are seeking to travel to, even if it's just to see family.
Yeah, 100%. I have a list, and it's about as long as my arm. Jamie, last but not least.
Hi, I'm Jamie Nautman. I'm a fertility doctor at CCRM New York. I focus on, I take care of patients who are trying to get pregnant and patients who may want to get pregnant in the future, which the global term we call is fertility preservation. I would echo what you said, Lydia, when we started. I think in my career have never seen so many women coming in to freeze their eggs as we've seen in the past year. And also I've never seen such high rates of women using donor sperm to become single mothers by choice. So I think that's really was one of the most dramatic shifts I've seen in the pandemic. I say this to patients all the time, that one of the biggest shifts I've seen in my career is also the age of the egg freezing patient, where we used to see women coming in their late 30s, early 40s. And I don't know if it was because of the pandemic or social media or what it was, but now the average age of the egg freezing patient that I'm seeing is about 32. I also am the chief medical officer of an organization called Chick Mission, where we raise funds and provide grants to women who want to freeze their eggs or embryos ahead of cancer treatment. So that's what I do when I'm not seeing fertility patients.
I think I need to lay down and take a nap now, given how much she's doing. And those statistics and trends are really fascinating. We know that so much has changed over the last year. But I want to go back to something that Jake said in the introduction about the importance of education. Can you just talk a little bit about, Jake, how important a role education plays in fertility, and what you think the employer's responsibility is to discuss topics like treatment options, planning, preparation, all part of that education?
Yeah, so we're biased, but the part of the elephant we really hold on to is education. And whether you're doing adoption, foster, surrogacy, natural conception, these are dissimilar processes. Lots of life-changing, life-altering decisions you got to make. Snap decisions, sometimes with no data, which is a very uncomfortable place for all of us to be. So that's what our focus is. I do believe money's important here. I don't want to be dismissive. Money really is the governor to access. However, we've got clients like Apple where a lot of the employees have a lot of money to spend. And we have clients like hospital systems where that's not the case. And whether people have money or not, once they matriculate the way through the process, they're going to be faced with major decisions to make. And I've really never met a rich patient or a rich adoptive parent who says, this process is no problem. I've got all the money in the world. Money won't solve some of these issues. Great information in our mind is really important. I don't want to comment as to whether, it's a company's job to do one thing or another. I will say if they are committed to making sure that people get through this process with their sanity intact, if they're in a relationship with their relationship intact, and with their budget intact, I'd argue that education's critical. And the good news is it's the cheapest part to provide. Spending the money on adoption and foster, that's really expensive. Arming people with education, that's dirt cheap. And so I do think it's the right thing to do and it's good value. But of course, that's our mission. So we're pretty biased.
Well, thank you for qualifying your answer there. But I want to just kind of take that concept of a cheap way to provide something for the employee. And Sonia, I'm going to come to you next. And can you speak to how companies are helping workers navigate the journey, and more importantly, where you see the investments being made?
Yeah, absolutely. So to your point, 31% of companies are offering fertility benefits, and about 75% is really covering the cost of fertility medications as well as IVF treatments. And so that's great. That's a start. But the reality is that fertility is not an episode or an expense. It's an emotional journey. And reimbursement is really just the start. And so what we're really seeing is the best in class employers are thinking about fertility benefits in a really comprehensive way. The first is just continuous comprehensive care. So really thinking long before fertility starts, to Jake's point about education and really helping to support issues around nutrition or fertility awareness or those kind of components. So really early on in the journey to be able to help versus just kind of getting to the clinic, if you will. And then secondly is really around inclusive care. So talked about that before, but the whole point is there are many paths to parenthood, and being inclusive around all of that, supporting in addition to medical diagnosis of fertility treatment, but also adoption and surrogacy, supportive LGBTQ plus single parents, as Jamie mentioned in her introduction. And then lastly is really thinking about it on a holistic care basis. So we talk about the money, we talk about the education, but really thinking about it from an emotional and financial perspective is really important as you think again around that entire comprehensive journey. And more often than not, I don't think people understand how emotional that journey is. Mm-hmm. And so making sure that you can have access to all of those components in one place, I think is core, and what we are seeing in the market as we're really evolving what that looks like going forward.
Yeah, I definitely want to talk a little bit more about this, the emotional part of the journey, the mental health part. But I want to hear from those who are at the employers first. Deshawn, can you talk a little bit about what benefits are being offered currently and what's changed, if anything, over the past year?
Yeah, so I love the fact that Sonia essentially mentioned that it's got to be like a comprehensive strategy that we have to essentially have in place, right? So there is that financial portion, and yes, we definitely do offer adoption assistance, right? There's less around the surrogacy option, but even when you're talking about how much you can actually get for the fertility journey, all of that type of reimbursement stuff, those are the basic things that I think your insurance providers are providing. And then sometimes there's some supplemental things that companies can put on top of that. But then it's that mental anguish. It's making sure that you have that time in which to be able to go to the physician in the morning, because you have to do monitoring in the morning and all of those different pieces. So really what we have transitioned to is how do we ensure that we're continuing to develop inclusive leaders? And inclusive leaders is enabling our team members to bring their authentic selves to work. And your authentic self might be that you're on this fertility journey, either as a male supporting a woman who's going through this, or as a woman. And so you might have to have a flexible work schedule. Does your leader essentially understand that? And are they willing to support that? That your schedule is going to, it might fluctuate for the next 2 to 3 weeks, or it could be going on for several years, all depending on how long you're on this journey. And so we make sure that we are driving that type of supplemental learning and really growing our leaders to be all inclusive leaders, to make sure that they can lead a full person and allow them to bring their authentic selves to work, as opposed to just focusing on this performance piece. Because I can definitely tell you that as you're going through this, there's a chance that your performance in itself could fluctuate. However, if you have someone who understands as a leader the journey that you are currently on, and they're able to, you can communicate with them, you can create that balance and that understanding that you're going to be off for these few hours, back on. If you got some bad news, hey, I might need a moment down, but I'll be back on later on this evening. It just makes for a collective environment and better performance in the long run.
Mm-hmm. There's been so much talk over this past year about extending grace and patience first and foremost, but also flexibility and what that looks like and how you just navigate your work-life balance. I don't think that it's been top of mind for a lot of leaders or employers as a whole to kind of have this discrete piece of flexibility really kind of come under the microscope, and how would you offer it to people? So it's very interesting that you're making a concerted effort there to extend that flexibility in this way. Marty, what's changed over at Warner, if anything, over the past year or maybe longer?
We too have developed a flexible working program and caregiver time. We've given additional days for people that, you're on top of each other right now. Your kids were not in school. So, you really had to balance, maybe not taking calls or Zoom calls in the morning, or, going in later, logging on later at night because you needed to make dinner. So we really tried to, we did a whole training company-wide, and we did it from top down. So our leaders were the ones that communicated, hey, flexible working for caregivers, whether you're taking care of a parent, whether you're taking care of children, even if you're taking care of yourself. We tried to get people to step away, and, we started doing meditation, just randomly during the day, to just say you needed a break. You need to take care of yourself. Otherwise, you can't take care of anybody else.
Right. Put your own mask on first before you assist others. I mean, that's sort of the, but have there been any changes with regards to family planning and fertility benefits?
We rolled out a separate program 2 years ago, and how we actually presented it, somebody mentioned earlier, it's family planning. That's how we're presenting it. It's not infertility, it's not fertility. It is to support you wherever you are in your life, and how you're going to plan your family. And again, we have had many people that have done the voluntary egg freezing. It wasn't because they had a medical condition. It's just at this time in their life, that's, what they need to do at this point. We have a diverse population. We have a lot of same sex couples. So clearly we want to make sure that they can have the family that they want. And so, that's just been our theme since we rolled it out, is that this is a holistic program for you. It has nothing to do with medical issues or anything. It's where you are in your life.
And it was good timing, even if you didn't know it at the time, that you rolled it out a couple of years ago, because I've heard a bunch of different organizations, representatives say like, oh yeah, we just kind of like, there wasn't any intent behind it. It just happened to be before the pandemic. So it just kind of made it easier to continue those offerings.
Yeah, for one of our candidate questions, one of the top 5 is, what is our fertility or family planning benefits or leave options? So that really drove us that if we wanted to be competitive, we had to be, flexible.
100%. I want to go back to this issue about mental well-being through this journey. Obviously anyone who already has kids knows how challenging that can be on your mental health. But Jamie, from a medical perspective, what should employers keep in mind about their employees who are navigating this journey?
I think it's so appropriate that we're using the word journey, because one of the things I've learned doing this over the years is fertility treatment is a journey, right? A lot of us think we're gonna, stop our birth control, have unprotected intercourse, and get pregnant. And we're very shocked to see that is usually, unfortunately, not the case, right? And I think that what happens is you have to accept in a way that you may be at this for a long time, and you may take, sharp dips down, up a hill, right, left. Your journey may deviate from what you planned. And what I see is a lot of couples have trouble accepting that, right? And sometimes when we have trouble accepting that, we can quit, right? We can stop too early, or we can let it take us over, and it changes our personality. It changes our relationship with our partner, our family, our friends. I talk about counseling or support to almost everyone, because I think this is such a difficult process for people to go through. And for many couples, they go through it alone, right? Because for some reason, there is shame or guilt in saying, I'm having infertility, or, I'm freezing my eggs. I saw a patient last week who's 35, came in to freeze her eggs, and she was so embarrassed that she had gotten to this point in her life and hadn't found someone. And I said to her, quite the opposite. Look how amazing it is. It's so awesome that you came in to do this, and that you're taking control of your destiny, right? You're shaping your journey and your future. But I think if people don't talk about it, then they're alone, and then they oftentimes go down sort of negative pathways because there's not people around to support you. And one of the most amazing parts that I have seen about companies that provide these services is it almost sets up like mini support groups within the organization or within the company, right? Like, hey, I'm freezing my eggs. Did you freeze your eggs? Like, we can do it together. I've had patients where, a group of women have done it. They've picked each other up from their procedure, or, everyone has sort of supported each other throughout it. So I think,
I can't imagine that there's any better bonding experience than that if you're all going
like
through it.
their friend too. Like, I'm in the friend group now. I'm like, oh wait, I'm taking care of 5 of you. What are we doing? I've gone to like weddings and baby showers, and I'm like, oh, everyone's here. But I think we have to reshape the way we think about it, because it shouldn't be embarrassing that you're freezing your eggs. It should be, it's great. There's no, and the same thing with single mother by choice. I think that is an incredible decision that women make. Mm-hmm. And I often say, I'm not like, sometimes groups online can get a little, they can go deviate a little bit too much one way, but I say, go on Facebook. There's like groups where people will help you get through it. Not only will you make friends, but you'll feel less alone in your decision.
Right. I think about ERGs when I hear this talk about support groups, and I haven't heard that there's a specific ERG, but perhaps Deshawn or Marty knows from their own career journeys. But that seems like it would be a good one to be in. Sonia, did you want to add something to that about the mental well-being piece?
Yeah, I think just to reiterate some of the points we've talked about, we know that 40% of women that are going through the fertility journey do struggle with anxiety and depression. And actually research shows that it's the same level of anxiety and depression as those with cancer or heart disease. So, this is not specific, you're right? It is across for women that are going through a variety of issues. But I also think, just to share a story, we have what we call Maven Moments. And we had actually one of our members come on to a team meeting last week, and she shared that she was actually the daughter of one and had been diagnosed with secondary infertility. And through using Maven, she was obviously very shocked and distraught of having the challenge of what you just said, Jamie, thinking that she'd be able to, conceive and go through it. And signed up for Maven, got access to a reproductive endocrinologist who referred her to the right fertility clinic, and started that journey. But what she said was that it was really the mental health aspect of it, of where she was needed the most help. And so she really needed the mental health to deal with the pain and grief of going through not being able to have the family that she had originally envisioned. The second one was the cyclical grief, right? So going through all the injections, the 2-week waiting periods, and unfortunately the inevitable negative results, which is very real, and working through all of this as well. And then lastly, like, I think her summary of it was 90% of the journey is mental. And so having the physical side is doable. It's hard, but it's doable. But it's the mental health side of things is really where you need the support and someone to come help guide you through that. And so I just think we can't ignore that fact, and making sure that, again, it's harder to access that more now than ever, and not having the stigma around it either. And just really thinking about that as a very, just a comprehensive part of the journey in terms of what you're going through, and making sure you have those support networks as well.
Yeah, I mean, I think that it's so challenging for people who want to start a family, regardless of where they're coming from, that you have this idea in your head of what your family is going to look like. There's that piece of it. And then there's all this societal piece of it, which, can sort of lay on the shame and guilt and shame and guilt and shame and guilt until, and it's counterproductive. Jake, I was actually going to come to you next because I wanted you to speak a little bit to the individuality of these journeys, but you wanted to add something to this first.
Yeah, I was just going to say one thing I also think about when I think about the subject is regret, feeling of regret. And I think a lot of us think just because a benefit's there that you should use it. There's a study out of UCSF that showed a fair number of women, probably about 15, 20%, regretted the decision to freeze their eggs. And I think a lot of that had to do with, and the correlation was, what did they know a priori, not ex post. And so I think really helping people understand, if you freeze your eggs, what are the odds you're going to come back to use them? And across populations, it's usually not high. And then how to figure out the right questions to ask your clinic, the KPIs to know whether they are doing this for the first time or they've been doing it for a while and doing it excellently. And then if you need those eggs, what are the odds are going to work? And so I would just say, I think, mental health goes hand in glove with education here. People that didn't feel educated beforehand, many of them regretted the decision. So in terms of individuality, gosh, I would say individuality and family building go hand in glove. I mean, I would say the path for family building, if you're transmasculine, so assigned female at birth, going off hormones, having eggs retrieved, once you're done breast or chest feeding, resuming testosterone, I mean, that's a completely different path than for many other people. The success rates for fertility treatment, both IUI and IVF, are different oftentimes for Black and African-American women, Latinx, South Asian, East Asian, even success rates sometimes for military families are different. And there are unique underlying both medical and cultural reasons. For instance, if you're a Black or African-American woman, more likely to have challenges around uterine fibroids. And so how do you think through sequencing treatment? And so, so for us, and that's just at a, orientation and race level. There's plenty of others by age, by income, by number of children you want to have. So, from our standpoint, we're trying to build courses, which is a brute force way of trying to explain things to people because we only know so much about them. We have to be very intricate with defining whom we're talking about by diagnosis, by race within each course. And in our minds, unless you kind of get down to that level, you're kind of not helping anybody. And so the individuality is a major opportunity, but it's a major challenge from an educational standpoint.
Yeah, I was going to say, I mean, if you are drilling down to that level of uniqueness with each, how do you unpack the complexity for everyone and make it more equitabable?
I mean, from an intersectionality standpoint, none of us are just one thing. I mean, it would be easy if you just did specific diagnoses or races. These things overlap, and then you overlay it globally. You can't do egg freezing in Germany, can't do it in China. Then all the things you can't do. I mean, that's why it's hard to be really particular, but you got to get down to that level if you really want to help people in our minds.
Mm-hmm. I want to go back to Sean and Marty again. And can you explain, just unpack a little bit more, Deshaun, you start, how your organization makes these benefits and services more accessible for employees that have all different kinds of family structures?
Yeah, most definitely. So listen, we essentially through our benefits team do a lot of communication around what is out there. Of course, when you have open enrollment, a lot of these things come up too. I think where the opportunity lies, and I'm sure we can all speak to this, is corporations as a whole have had to take on a different life form in terms of what we are willing to talk about in the workplace over the past year. Right? When you think about it, a year and a half ago, companies were not talking about systemic racism. They were not talking about privilege. They were not talking about some of these things that have been taboo in the workplace. And so what we're also now getting into is that space where individuals as well as leaders are willing to now engage in some of these conversations that have actually been so private. And the family planning journey, the fertility journey has become one of them. And so what we have been doing over the past couple of months is figuring out ways in which to create space, whether it's through our women's TMRG or even through some of our benefits conversations in terms of how we are going to not just tackle this particular topic, but ensure that people are going to feel more comfortable leaning in and being supportive of each other. Because to Jake's point, a lot of this comes down to education. And the honest truth is that there's so many women I know in my organization who are quietly on this particular journey. There are men that are struggling in which to figure out ways to support their partners, their spouses through this. And they don't necessarily have a safe circle in which to go to because, again, it's not something that was discussed at work. But now when we're talking about being able to bring your full self to work, when we are talking about the ability to really be able to engage in what we call at Hilton courageous conversations, this is one of the topics that we absolutely have to hit. And so we've been working through our framework of our Courageous Conversation series, as well as working very closely with benefits to determine, what's going to be the right cadence and timing to continue this educational conversation and continue developing and establishing leaders that are going to be able to support those on this journey, whether they're wanting to openly disclose or not. And so that's going to be key.
Don't go yet. I'm glad you brought up the courageous conversations thing, because I think that, again, when you hear that, you're thinking of a very specific thing, and especially over the last year with all of especially with the Black Lives Matter movement, those courageous conversations were very dedicated to racial injustice. So can you just give the audience a taste of how that framework works for drawing people out and making them feel comfortable?
Yeah, so actually, although that is where we started, and we started talking about really our first session around courageous conversations was on the impact that COVID was having on our industry. I mean, travel came to a complete and utter standstill, and we had to make a lot of difficult decisions inside of our organization in which to be able to hit the point of recovery where we are now. And so we talked about the impact of COVID, as well as the impact that systemic racism was essentially having, not just on our team members, but of course on our guests and on our communities. From there, we kind of navigated through what does inclusion need to look like, right? So you have the definition of diversity, that's about a representation and a stat, but also what does inclusion need to look like and feel like, so people feel as though not just they have a seat at the table, but they also have a voice at a table that's going to be respected. We then delved into mental health as a whole, because all that we have been going through, I think the one thing we can fairly say is COVID has impacted each of us in similar ways, but also in different ways. And so what does that look like? And you can be fine today and absolutely not fine the next day. And it was an up and down roller coaster. And so having the courage in which to start talking about mental health holistically, and now we're getting into the place where we can start breaking it down and say, all right, what are the different aspects that can chip away to some extent at one's mental health? And honestly, the family planning process, right? The fertility process, if you will, is a huge one. Because again, there's so many individuals that are facing it privately or publicly and it's not being spoken about, but truthfully, in which to be able to even pay to go through the process, let us start there. You have to be able to perform in some aspect of it, but in which to be able to perform, you need to have the proper support system. And so some of that needs to be coming from your leaders and essentially that workplace.
Yeah, all good points. Marty, can you talk about accessibility and equity with those benefits and how that's playing out?
Sure. So, when we rolled it out, we really wanted to, get over the hurdle of the gatekeeper. We want the person and the family to be able to speak with their doctor to get to the right procedure that is good for them. It used to be if you were just going through a medical plan, you needed to, have certain medical conditions or have, miscarriages or something. We just wanted everybody to be able, again, we package it as family planning. So it's not necessarily about having to get pregnant right now. So we really wanted people to be educated on all of their options, getting treatment when and how they want, offering them the best in class, clinics. A lot of people don't really know even where to go, to freeze their eggs. They don't understand the storage process. All of this, what's IVF versus artificial, so all of this, they don't understand what is the best outcome for them. So, we were very open about, hey, this is for anybody and everybody. And it was really well, received. We did put out a little blurb about it in Top Stories, which is a newsletter that we do in our industry. And, even our partnering companies said, oh, wow, that's great. Our competitors that you were doing this. So, really we wanted to be inclusive. It didn't matter what type of relationship you were in or not in a relationship.
You mentioned miscarriages, and I know that there's been more talk of late, but I personally don't think that there's enough talk about it. We're just expected to, have this happen, have it be, again, a discrete episode, and then, go back to work and just kind of get on with it. And, everything from the sort of conversations that you have with people afterwards. And, in case you haven't guessed already, I had a miscarriage myself years ago while I was at work. That was quite a thing. But I can't tell you how many people came to me and said, oh, don't worry, you'll get pregnant again. Just get on with it. And, that's still astounding to me that people still say things like that. And so, while we're talking about this well-being thing, I can't help but think that that's got to be a destigmatized part of the conversation as well. Sonia, do you have some thoughts on that?
Yeah, absolutely. I just couldn't agree more with what you said. I mean, and again, the example I used earlier, just of somebody going through that, and I've been through that personally as well. And it's just the reality of, people kind of just don't think about, again, what do you need next, right? Do you need mental health help? Do you need help? Do you need time off? Do you need a period of time? Do you have to go through a procedure? What is the best, resource that's available for people to help support that? And that is not something that's easily accessible, in order to find all of those resources, other than speaking with a friend or, to your physician. But sometimes that's happened before you've actually gone in for your first prenatal visit, for example, right? Or, depending on the timing. So I just think it's so important to think about that aspect of, the journey. And hopefully many people don't have to go through that aspect of the journey, but for those that have, to be able to be really comprehensive and not, to your point, destigmatize it, allow us to have the conversations and to treat that as, as part of what we need to all get through as well. And then everybody has a different way of addressing what the next step in the journey is, right? In terms of whether you go forward or whether you stop or what you do next. So
yeah, and how your employer allows you to function on that. Go ahead, Jamie. You wanted to add medical perspective, then Jake, I'll come to you.
One thing I've learned is I think sometimes people and physicians included, we're so uncomfortable with bad news and giving bad news that rather than sitting in it and being like, this is so devastating, you had a miscarriage or you have no embryos or all your embryos are abnormal, we sort of rush to get through it because us ourselves, we're like, oh, I'm so uncomfortable with bad news, but we don't remember that the other person on the line or sitting across from us needs us to sort of take away what's bothering us and be present for that person. And that's taken me a long time as a doctor to get to that place. I think when I was like a younger attending, a resident, a fellow, I was probably that person who was sort of like, all right, you had a miscarriage, like try again, because I was almost like immature and not aware of what it meant to sort of have loss, or it meant to not get what I thought I was going to get. And I always say to patients, I myself, I never had infertility. So I used to think, how can I really relate to patients that I'm sitting here, but I had cancer. So I'm able to take that and say, how was that experience for me? A phone call that I never expected to get, a journey I never expected to be on. And I've used that experience, I think, to be a better, more empathetic doctor, because I realize now people need you to just be in it with them, like whatever way you can be. And listen, we don't have all the answers. Unfortunately, a lot of times we don't. And that's unfortunate. You have to be okay with that. Be like, I don't know why you miscarried, or I don't know why your embryos aren't sticking. But being a partner with a patient and saying, we'll get through it together, rather than rushing out of the room because it's so uncomfortable to be there, is so important.
Before we go on, Jake, I'm coming to you. So just hold that thought 1 second. I just want to remind everybody that we are going to have a Q&A in a few minutes. So if you do have some burning questions, please drop them in the Q&A box, and we'll try to get to as many as we can. Sorry, go ahead.
I think miscarriage is a super important subject. People can accuse us of being a niche within a niche, fertility treatment, but miscarriage is not a niche. 1 in 4, 1 in 5 pregnancies culminate in a miscarriage. We had 2. It was a death in the family, like no question in our mind. One of the things that I think astounds us is how bad the information is around miscarriage. So, the tests that people have done to tell them whether they're miscarrying or not, oftentimes are not the right tests. And then once you've miscarried, people aren't often told about testing the products of conception so we can figure out why you miscarried. And that might help us figure out what the best medical path is forward. And I got to say, the number of people who have never heard of product of conception testing, don't have it done, and it's too late. At some point you can't get it done. And so in our minds, if there's one field where I feel like the issue is so common and the medical information is so abjectly poor and so much is on the line, it's this issue. And honestly, we're amateurs, we work with doctors to build these courses, but it breaks our heart to see how bad the information is in this corridor.
I want to go back to something that Jamie said about being a partner. And when I think about benefits like this, it almost puts the employer in partnership with the employee to help them navigate that journey. And also, as Deshaun was saying about the flexibility, it puts the leaders of the organization in partnership with the employees. And using the miscarriage piece as an example, there's a grieving period that can and should happen afterwards so that that employee can come back and be their best self at work again. And I think that a lot of leaders are missing the boat on that. So again, I want to talk about that a little bit more, about how can we train this next generation of leaders to be more empathetic, to be partners with their staff. Who wants to take a stab at that? We're going to try to save the world in the next 5 minutes right here. Go ahead, Deshaun.
I can try. Listen, I think it's really about a holistic leadership. I think gone are the days where leaders can think that they're just going to come to work and just coach and drive results based on what's on a piece of paper and based on what the MBOs and objectives might be. it has to be much broader than that. You are leading people. And I think we have to figure out, how do you tap into the emotional side of individuals? I too have suffered miscarriages, and it's interesting because even at the hands of one of my leaders who I knew also had a miscarriage, her thing was, oh yeah, don't worry about it, just keep going, like you'll get pregnant. And so it's recognizing that even though you yourself may manage something in a particular way, or your response may be this, it's having enough emotional intelligence to realize that everyone's approach to that point could be different, and then therefore resulting in somewhat of a different outcome emotionally and how they have to manage it. And so I would say that is one of the things that we are focusing on at Hilton, is how do you continue to drive greater emotional awareness and emotional intelligence, and infusing that into the leadership structure, because we cannot just any longer just talk about the numbers that need to be put on the board. You have to think about how do you train and support the person that's delivering on those particular numbers, and all of this has to be included.
Yeah, emotional intelligence deserves its own KPI, I think. Marty, you had some thoughts you wanted to add?
Yeah, so I'm going to take it from a different aspect of after the child's born. So what we actually rolled out is a primary caregiver leave. So it was agnostic of who had the baby. So, this way there's, most families, both parents are working, or again, in the same sex couple, who's the mother, who's the father, so you can't, so we rolled out agnostic to who had the baby, and, treating, everybody pretty much the same, and then they got the same leave. So that's how we really, started with upper management too, saying, yeah, you can't just say, oh, because you're a male, you're not going to be the primary caregiver. You have no idea what's happening behind the scenes, whether they're, they have a wife, or whether they're in, a same-sex relationship. So we really, kind of went that route and said, okay, it's getting there, and then what happens afterwards? So we're trying to develop policies that are inclusive and equitable for everybody on that process too.
Well, this topic seems to have touched some of our audience members as well, because we have one question. Love all the content, having serious PTSD, having gone through IVF in secret at work myself. My heart goes out to you. Any guidance about where to start with establishing an inclusive path to parenthood program at work? I'm head of HR for a small company, under 100, so budget could be limited, and anonymity from the employees. So my HR and DEI experts calling on you again. Where to start establishing an inclusive path to parenthood program at work? Go ahead.
From our aspect, it was really what our employees were asking for, and again, what we saw from the candidates coming. So we really needed to look at what was important, and then how to weigh out the cost of getting people to stay with the company versus leaving or not joining our company. So that can be part of your, I hate the ROI part of the,
No, but that's important. You have to build a business case.
It's very hard, but if you present it of, well, we're not attracting the right people and we're not keeping the right people. So that can just go against your business case a little bit. And that's what we try to do too.
I'll say for us really quickly, we also look at it from a global perspective. With us being a global company, it's critically important. We've got corporate as well as hotel level team members, and we try to make sure that there is a balance between the benefits that we're essentially offering. So how are we presenting things that are essentially scalable across the entire dynamic of our organization, and also sustainable?
How have employers planned for the added cost of supporting the fertility journey with higher costs from multiple births or prematurity? This is a very specific question. I don't know if anyone can answer that, but any takers on this one? Go ahead, Sonia.
Oops, I'm
Go ahead,
sorry.
Marty. Well, no, you go first.
Okay. So how we looked at it and the reason why we wanted a partner and to partner with the best in class facilities is because they just don't populate 8 eggs, so people aren't going to have the high risk multiple births. So, there's an education. People were really guided again to the right procedure and the right number of eggs based on their situation and whatever. It's not like going to a doctor saying, like the Octomom, okay, put as many in as you can because, so I think it all goes back to really getting the right partner instead of having somebody be misguided by a doctor of saying, oh, well, let's put 5 in and see what happens, So that was important to us, is to have kind of structure and give them guidance.
Okay. Sonia?
Yeah, and I would just add, what we see is that organizations are really thinking about the entire journey. So if you're starting and you have a partner that can help you at the very beginning on preconception and fertility, and then is carrying through maternity and all the way through to delivery and postpartum, and you have a consistency in that versus, multiple solutions across that are just kind of taking a slice of the journey, that is where we generally see the best outcomes and where you're really highly integrated with, the delivery system that's in person, right? The clinic component. And so I just think it's really important that you're, again, thinking really comprehensively across that. And that's really what we see drives the best outcomes, that ability to be very comprehensive across.
I would also say certain plans are better than others, right? Like, we're certain insurance providers, because some insurance companies still mandate somewhat antiquated rules, right? They do things called lesser before greater, or if you're under a certain age, you have to do 6 IUIs. Like, there's I don't know if I'm supposed to say specific companies, but there's certain companies that almost have, I don't want to say it's like carte blanche, but you have a policy that you can go and spend and make your choices, right? So it's much more user friendly than if you go with a traditional insurance plan that's going to say to you, no, you haven't done enough of this before you can go to that. And a lot of these plans are very against same-sex couples, because a same-sex couple will come in and they obviously can't try on their own. They're missing the opposite gamete, but the insurance company doesn't see it like that. They say, no, you have to go and try for 6 months or a year. So then that's impossible. So then essentially they're saying you have to, purchase donor sperm, which is expensive, and do inseminations, even if the, female partner is 39 years old. And we all know that's not the best way for them to spend their resources and time. We'll get on the phone a lot and do what we call peer-to-peers with insurance provider or, physicians that work at insurance companies. But even when you try and explain to them why this is not a good plan or a good approach, it's oftentimes, sorry, I know what you want to do, but we can't do it.
Angie.
Yeah, in our minds, this is a function of just education. Like, a doctor's not going to do something that you don't want them to do. So if you understand why doing IUI with gonadotropin is dangerous and risks multiples, and you can say, I'm not going that direction, we're going to do Clomid and IUI. Or if you say, listen, I will understand that my embryos may not look great and you want to transfer too, but I understand that if we do it, there may be a 30% chance if I deliver, it's going to be twins versus a 1% chance with a single embryo. And that's not a lifelong decision I'm prepared to trade off and make. It's not just about the delivery. It's raising children that were born prematurely. It's educating them. I mean, this is a classic example of snap judgment, life-altering decision. And if your legs are in the stirrups and the embryologist says, these don't look great, let's just do 2. Unless you understand the implications of that decision, it's easy to acquiesce and say, I want this over with. You're the doctor. Why not? And so even at great clinics, these still 3, 4, 5, 6% of deliveries are twins. And so this still happens. So unless the patient really understands themselves the implication, then you just don't know what's going to happen. So I think imprinting that in the psyche of the patient, I just think it's critical.
We We have another question that kind of goes back to something that we had touched on earlier. Many employees are nervous about speaking openly about their family process. Do you have any recommendations for manager training so that employees feel comfortable discussing their challenges more openly with leadership? Deshaun had talked about courageous conversations. Do we have any other suggestions for manager training that we can add to this? Oh, Deshaun, you go for it.
Yeah, listen, I'm going to be honest with this one. I really think it all depends on where your organization is on their particular journey. You can't just essentially just jump into having courageous conversations. There has to be some level of established trust between leaders and employees for you to even be able to get to that point. Because just deciding that you're going to talk about this without that established foundation, it actually gets you nowhere, and it can cause greater dissension and mistrust if it's not handled with care. So I would say, first and foremost, if you are on the leadership side of things, think about where your organization is on their cultural journey. Is it an inclusive environment? Do you feel as though you have executive leadership buy-in in which to even start to develop a culture that would be able to take on some of these particular topics, and not just that of family planning, but more holistically? Where are you with discussing mental health inside of your organization? Have you broached any of the social injustice topics, right? Because if you've kind of skipped that over the past year, then I don't know that you're quite ready to get into anything else. I'll just be honest with you.
No, that's an excellent point. And also to have a facilitator, don't you think? Like a trained facilitator?
I would say, yeah, make sure that there's a facilitation of discussions, and then also think about, do the benefits that you currently have and that you're seeking about rolling out in 2022 line up to you having these discussions? Because you also don't want there to be disconnect. If you know that today you're not offering any of these fertility treatments, but then you want to sit down and talk about fertility, and it's not on your radar, you don't plan on adding it into your budget, it just seems it's going to come off disingenuous and not truly advantageous to supporting a whole person.
Yeah, 100%. We have two people asking very specific questions about cost, and I don't know if we're going to be able to answer this to their satisfaction, but let's give it a shot. Maritza wants to know if there's an average cost per employee to add fertility treatment to the medical plan. Is there an average cost? Does anyone know? Go ahead, Jake.
So I think the question is can you get a rider? So based on your existing plan, can you tack on a rider so that fertility treatment is covered while you still got your existing plan? And my impression is the cost of the rider is substantial enough that it may just be worth paying for the patient to do it. So from what I've heard, it's pretty extreme. So I don't know if that answers Maritza's specific question. If your plan doesn't cover it, but you want to help one off, I've heard it's in the $5,000, $10,000 range, but I'm obviously not a benefit person, so I'll stop there.
Yeah, I would just maybe just to add is just, I think you can obviously go through your health plan too, but then you can also, to your point, Jake, structure the plan to have reimbursement and decide what levels you want those to be. Average IVF cycles are $22,000 to $25,000. So you can kind of say that you might want to, reimburse along those, and then have reimbursement programs that along that. And then of course, to your point, you can also incorporate it within your health plan, which has different costs. And obviously the costs vary by the demographic of your population, of your employee population. So, but there's a few different ways, I think, to address it.
Well, we could talk about this for another hour. There are obviously many challenges, but also very many opportunities. So I will consider this as the opening of this particular courageous conversation. And thank you all for being with us. I'm going to invite Nick back on because he's got a few logistical things to say.
Thank you so much. Thanks, Lydia. Thanks to all our wonderful speakers. This is a difficult and complicated topic to discuss, and I really appreciate all the thought that went into today's conversation. Thank you again to our sponsor, Maven, and thank you for joining today. In case you missed it, we're going to share something special that we have for the attendees of today's webinar. Thanks to our partners and our sponsor today, Maven. Our next monthly virtual conference on May 19th is entitled Diversity, How Employers Can Match Words with Deeds. Thanks to the sponsors today, we're offering a complimentary VIP ticket. That's to everyone that joined the webinar today. That is you, and you can get one right now. These are normally $149, so you definitely want to take advantage of this, and thanks to our partners for this, and grab them while you can. I'm placing that link in chat right now. If you click on the chat link in your Zoom client right now, you'll see a URL. That's a direct link. It bypasses our payment screen for our virtual event and gets you straight to a VIP ticket for joining today. So thanks again. If you'd like to join us for that and other virtual events, you can head to our website. Our website is fromday1.co. That's FROMDAYONE.co. You can check out our upcoming webinars as well. We have a couple coming up that I'll tell you about now. On Thursday, April 29th, that's 2 days from now, one on disaster readiness, relief, and recovery. On Tuesday, May 11th, we have one on hybrid back to work, which is a huge and hot topic right now, I think, for a lot of companies. Again, on Wednesday, May 19th is our monthly full-scale virtual conference. That one has panels, discussions, workshops, networking, in addition to just the webinar format. That focuses diversity. We just discussed it, and you can check that link that's in your chat. One more time, click on it now, grab a free ticket. Thanks again, everyone. Stay well out there and healthy, and we hope to see you again soon. This is From Day One.